Namaste, Doctor.
Namaste.
Doctor, how we can differentiate restlessness, naughtiness, and hyperactivity in children?
Okay, there are three words you have asked. One is restlessness, second one is naughtiness, or we can say hyper naughtiness, third one hyperactivity. So, usually parents confuse with two things, restlessness and hyperactivity. For some cases, if the kid is restless, also parent will say he is hyperactive because they know the word like hyperactiveness. So when we ask them, hyperactivity is little bit differentiated from this restlessness. Restlessness means without any cause they will be wandering here and there. They will not sit in a place without any reason. They will be wandering. In hyperactivity, what happens is they will show little bit of hyperactiveness. They will be little bit doing some pinching. Along with restlessness, all the symptoms will be there in hyperactivity, but extra will be this pinching will be there, biting behavior will be there, some kind of fidgeting will be there. These kind of extra activities will come in hyperactivity. These two are to be treated properly. But the third one, naughtiness or hyper naughtiness, there is a slight difference between naughtiness and hyperactivity. The main thing is naughtiness need skill to act. Hyperactivity and restlessness doesn't need much skill. Why? Because whatever the feeling inside, they are just showing it. When we say behavior and character, it's the same thing happening. For other adults, there are two. One is character, the other one is behavior. Behavior we can create, character we can create. For example, my behavior may be rude, doesn't matter. But if my character is good, that person is a good person. For some persons, behavior will be very nice outside, but their character may be not good. So it's like that. In adults, behavior and character will work, but in case of kids, to make or to be naughty, he need to think because he has to analyze others to show his naughtiness because he or she know how to drive his parents, how to drive the surrounding, how to drive his other family members. To know that he should have three skill. One thing he should recollect from his memory. Okay, my mother will be knowing this. So memory should work. He should have intelligence and he is acting properly. In Ayurveda, we say Dhi, Thridi, and Smriti. Dhi means intellect, Smriti means memory. So, to show this naughtiness or hyper naughtiness, a kid should have intellect as well as memory. Extra one thing, the middle one is the Dhridi concept. In the sense, when to act, how to act, or when to use this memory and when to use this intellect. So, actually speaking, in case of this autism, if the kid is hyper naughty, you should see it whether it is hyperactivity or hyper naughtiness. Hyperactivity should be treated because they don't have this dhridi coordination. In hyper naughtiness, this dhridi is there. That is why they are using their intellect to control their parents. That is why they are recollecting from their memory how I should act. So actually speaking, hyper naughtiness is good, but restlessness and hyperactivity should be treated properly. Namaste.